Now, returning to a story that has been bubbling away all week because of a decision made in the United States by the Supreme Court. Now, here in Australia, pro-choice advocates are calling for more investment in abortion care services in the wake of that decision, the Roe v. Wade decision. Providers say abortion access is already a postcode lottery, especially after the closure of regional Queensland clinics.
It's been nearly 4 years since Queensland decriminalised abortion. Parliament making history with a conscience vote to scrap 19th century laws after a long fight by the pro-choice movement. It allowed Queensland women to legally terminate pregnancy on request up to 22 weeks gestation, but advocates confirm access to clinical services in regional areas has rarely been more challenging.
You'd think that with the decriminalisation of abortion in Queensland that it would help improve services across Queensland, but unfortunately we've taken a backward step.
It's still a postcode lottery.
So in Queensland we see more of a patchwork of access.
Murray Stopes International is a leading provider of contraception and abortion services in 37 countries. It closed its only regional Queensland clinics in Townsville and Rockhampton last August in what was described as a difficult decision with the deepest regret after exhausting all possible options over rising costs.
We had government support to operate clinics in Queensland. It wasn't enough. And we had requested additional support, however that hadn't been provided.
That was disappointing, but that's a commercial decision for them to make.
Advocates say an over-reliance on private providers has left devastating gaps in services.
This isn't something that traditionally the public hospitals have done. We have funded other providers to do this.
And now we've got less private clinics available in Queensland, which means that instead of being able to get more localised healthcare, people are having to travel, sometimes hundreds of kilometres.
The costs of travelling to the southeast are prohibitive for many, even with Queensland's patient subsidy system, especially for domestic violence victims and single mothers needing childcare. Patients have also reported waiting times of between 4 and 6 weeks to visit clinics in Brisbane and on the Gold Coast.
We've only got so many spots that can sort of be taken up, and with pregnancy, gestations can't wait.
I met a local barista just a few weeks ago who 6 months ago found out that she was pregnant and was considering her options. When she found out that there were no surgical termination services available in Rockhampton, she felt like that choice had been taken away.
Brittany Lauga is the State Labor MP for the Central Queensland seat of Keppel and the Assistant Minister for Education. She's been critical of her own government's delay in restoring services to Rockhampton, has led local rallies and told Parliament enough is enough.
Time is of the essence here and we really need these services to be restored.
I absolutely believe we need to step up and fill those gaps, and that's what I'm asking our HHSs to do at the moment. It's
a legal medical procedure that can happen in Queensland now, so I don't understand why it can't happen right now in Queensland.
Pro-life advocates deny there's an access issue, claiming abortion numbers have skyrocketed.
Make no mistake, this push is lobbying for free abortions, even up to birth, at taxpayer-funded hospitals.
Due in part to medical abortions in the form of prescription drugs.
The data shows there has been over a 100% increase in the number of GPs, general practitioner doctors, prescribing the abortion drug.
It's only available up until 9 weeks gestation, and it also requires the woman to have an ultrasound beforehand.
And those supporting women with unwanted pregnancies say the mental health impacts of the clinic shortage are also taking their toll. Claire Todd-Hunter, Sky News, Brisbane.